Morning you guys, it's Karen, and I thought I would come and talk to you about how the Botox for migraines is going. I had it 3 weeks ago today, so I will be doing other updates because it's only a small sample size at the moment because it can take up to 2 weeks to kick in. So I will be doing other updates because there's more they can do in terms of Botox as well, which I'll explain as we go along. The first thing I want to talk about is how you get the Botox, because there's been a lot of comments whenever I talk about Botox. There's comments that say, you know, oh, you're so lucky to be able to get that in Scotland, or you're so lucky to be able to get that in the UK, or how much does it cost? Things that are maybe don't understand that there is a process to get this. Firstly, I am in the UK, so we have the NHS, which is free healthcare. Not everybody uses the NHS, but most people do. You can get insurance, special private insurance with your job. Sometimes it's becoming more popular now, but most people don't have private health insurance. If you do have private health insurance though, from what I've seen, and my husband has it with his job, I can't get it because I've got too many pre-existing conditions. But from what I've seen of it, it's not like the system in America where you can choose what consultant you go to see. You can just ask for a procedure and have it done. I say that because I've seen videos recommending people get a colonoscopy, for example, in the UK when you're over 40. That's not something we can do. You cannot just go to your doctor and say, can I get a colonoscopy? And even if you wanted to go to your private doctor, so Kev has Bupa, private health insurance, but if he wanted to see somebody, he has to go to an NHS doctor who has to refer him on. The only difference really is that it would be quicker than the waiting lists on the NHS. So if he wanted to see, say, a urologist, he would probably have to wait on the NHS like 6 months, something like that, but he would probably see somebody in a month privately. I went privately and had a second opinion for my knees years ago, and it was super quick, and it's kind of a different atmosphere, you know, when you go to a private hospital. So we have the NHS. It means that we can't, if you're on the NHS, you can't just choose a consultant. Like I said, I can't go to the doctors and say, I want to see this person. You have no idea who you're going to see. Sometimes there'll be a name on the letter you get confirming your appointment, but you're not actually seeing that person that day. Yeah, I just wanted to explain that because it's just not, a lot of people have said, again, about the Botox for migraines, make sure you go to somebody that is experienced in this area and this area. And like I said, you just don't have that choice. I got a letter to say that I was going to the migraine clinic. It didn't even tell me who I was seeing, and it wasn't a neurologist, it was a nurse. And if I say, no, I don't want to see that person, I want to see somebody more experienced, I wouldn't be able to get the Botox for free. Well, I wouldn't be able to get it at all. So I do get it for free on the NHS, which I think is just amazing. But I think a lot of you think that I've gone to the GP with migraines and they've just given me Botox as an option, and it really hasn't been like that. Obviously, I've got a lot of videos on here talking about what I've tried and what I haven't tried, and they span years. So I've had these headaches for 17 years, but they were occasional until about 4 years ago, nearly 4 years ago, and then they became daily, and ever since then I've had them daily. And so this has been a nearly 4-year battle for me to get something that works. And the way that it works with going to the GP, firstly, again, people have said, oh, you've obviously got a GP that listens. It isn't that simple. I've gone to many different GPs because I'd go to somebody and they'd just say, take this, and it didn't work. And I had to go back and really fight and say, you know, I'm in pain here every day. Like I'm not working anymore. I can't hold down a business, etc., etc. I had to go and really fight my corner. So I would say if you are in pain daily, or even less than daily, you know, then keep going to the doctors and keep on saying, you know, I can't live like this, I need some help. So then when you are having certain conditions or certain symptoms, there are guidelines for the GPs in Scotland, which are called the NICE guidelines, and they have to follow those as to what treatment to offer and when to refer to neurology. Again, I can't just say refer me to neurology. It's tricky as well because there's often different choices. So there was the physio I was seeing was talking about referring me to a pain clinic. That has never been done. I have asked about that, but it's never been done. But I did eventually get referred to a neurologist. The problem was you can't get referred to a neurologist until you have tried 4 medications. You have to have tried these 4 medications for a long enough time before you get referred to neurology. Now, I had been referred to neurology like 10 years ago and been diagnosed with migraines, but because they were occasional, that I was kind of discharged from that. So you have to start again from the bottom. So the medications, you have to have tried 4 of many medications, and I have tried 4 of them. So amitriptyline I was already on. Amitriptyline is something that works on nerve pain. I'm already on that, so you could kind of tick that. I had to try candesartan. Candesartan is a blood pressure medication, but again, I was already on it. So it's something that sometimes the headaches can be coming from high blood pressure, and candesartan works for that. One of the other ones is topiramate, a horrible drug in my opinion, but it did work for my migraines, but it made me feel blooming awful. I've done a whole video on topiramate, so that's one of the ones they asked me to try. Beta blockers is another one, but I couldn't take beta blockers because I have asthma. So beta blockers, topiramate, amitriptyline, candesartan, that's 4. There's another one, because there's another one I've tried. I can't think of the other ones, but what I'm saying is there is a pathway that you need to have ticked these 4 things before you get referred to a neurologist. Then you get referred to the neurologist. I had a telephone consultation because it's, because of COVID times, and he went through all of my symptoms and asked me to keep a diary and told me to reduce the codeine that I was on, and said that he thought the Botox migraine clinic would be amazing for me. So those are the steps you have to go to get some sort of treatment. So like I said, this has been a 3 to 4 year journey. It's not something that I've not been lucky and had one GP, gone and told her I had headaches daily and got sent for Botox. It just didn't work like that. It's been years, and it's been very, very difficult. So on to the Botox appointment. I was very nervous about it because I had read a website called drugs.com and about people's experience with it, and people were talking about having problems swallowing and problems breathing and all sorts of things. But you get a consultation with the nurse before you go to your appointment. So she phones you a couple of days before to make sure that you've, to go through a list of kind of medical things and to ask if you have any questions. And, I told her I was a bit apprehensive about that, and she said she'd never come across anybody that had any problems breathing. There is a risk that you have problems swallowing, but it's very, very rare. That clinic had been open for a year, and she had one person that had swallowing problems. She didn't say exactly what the swallowing problems were, but I already have swallowing problems from my Ehlers-Danlos, so that was something that made me very nervous, but the pain was just so all-encompassing, and affecting my life, that I was happy to take that risk. So that all went fine. I arrived for my appointment. I made sure that I shaved I've got an undercut on my hair, and I made sure I shaved that so that there was easy access, and I had a hairband with me to put my hair up. And it was a nurse that saw me, and she had somebody that was training as well, and so she explained to me everything about where they were going to put the injections. She said it was actually nice doing somebody that was used to having Botox, because of course I've had Botox for years cosmetically. We did discuss about the fact that my eyebrows might droop. I said to her, my eyebrows might droop, but at this point I don't care. Usually I'm going for the opposite. I want my eyebrows to be lifted. So she did say to me, well, she said they normally go in the forehead, and she said what we can do is go a bit higher to avoid them drooping too much. So she then just got started and did the injections, and there's no I didn't have any makeup on, by the way. I made sure I had no eye makeup on. She says have nothing above from your brows upwards, have no makeup on, so I had no foundation on, didn't have my brows done or anything, didn't have any eyeshadow on. I just went with no makeup on, and she didn't actually cleanse the area, and I don't know, I think that has happened with cosmetic Botox. I don't know why it didn't happen with this. I guess because a lot of the ones they're putting in your head, you're going through your hair, so there's just no way of, being completely sterile. So the places they did the injections were along my eyebrows, so it's probably one there, and one there, something like that. These are injections that I do have to lift my brow, but it's very, very specific where you go in the brow. And I don't know what the differentiation is, but I've had it done before where you can put it in the brow to lift the brow, or you can put it in the brow and it makes the brow droop. So she did across my brows. Then they normally do the middle of the forehead, but she said she would do it a bit higher up so that my brows didn't drop as much. So she did some up here. Then they do some here above your ear, and it just goes straight through your hair. And here is specifically I think it's called vagus nerve, the one that is thought to be very responsible for the migraines. Then she did some here, then she did some here, then some at the base of my neck, and then all the way across my shoulders. She used 150 units and there was about 30 injections in total. But 150 units is a conservative approach. So what they do is, for the first time you go, they do it conservatively, but just to make sure that you don't react badly to the Botox, that you've then not got as much as you could have in your system, because you can be given up to 200. So that's why they do it conservatively, and also see how strong your muscles are, because what they're trying to do is freeze muscles and stop nerves reacting. When she was doing mine, she said, your neck is so tight. She said, I would bet money that you won't get as much from this lot of treatment as you will from the next lot of treatment, which will be 200. She said, next time you come in, if everything's gone well, they'll do 200 and focus more on my neck and shoulders, because the muscles are really tight. So yeah, about 32 injections. They didn't hurt. I'm used to having the ones kind of on my head. They don't hurt to me at all. It's like a second you feel a needle going in. To me, it's less painful than having blood taken. I feel like with blood, they push in the needle in, and I actually don't like it. I don't freak out or anything, but I don't like that. Whereas Botox, it's just bunk, 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 you can kind of feel a little bit of coolness when the liquid goes in. The one that hurt, bizarrely, was the ones above here. The ones going in here actually did hurt. Actually, I'm pressing on that and I can feel that kind of hurts, which is weird. But yeah, the injections in here hurt. There was one at the back of my head that I was like, oh, that hurt. The ones in my neck didn't hurt at all. I would not worry. If you are worried at all about the pain of the injections, I would just say don't worry about it. Really, you will... If you'll get yourself worked up and then come away going, that was just not so bad. That was not bad at all. It's so quick. You don't have time to think about it being painful, when I used to have Botox under my eyes, that was very painful. But again, so quick. So I had the injections and that was pretty much it. The aftercare is, you are not to bend over or lie down for the rest of the day. I think it's 24 hours. So you're not to, I couldn't like lean down and stroke Watson, and I couldn't lie down within 6 hours, I think it was. You're not to do any exercise for 24 hours, so you're not to go to the gym or do anything strenuous. It's just to save the Botox, to try and keep the Botox where it has been injected, because problems can be caused if the Botox moves around, and you don't want it to go anywhere near your throat muscles or anything like that. So you need to kind of, you don't need to sit and do nothing. You can sit, you can walk around, you can eat, you can do everything normally. Just don't do anything strenuous, don't do exercise, and don't be, bending down and throwing your head around. So I made sure I did that. You can't wash your hair for 24 hours at least, I think it was. I made sure I left it 48 hours just to be sure. So I freshly washed my hair before I went. And that's because if you do this and agitate the places where the Botox has gone in, again, it may move around, and you don't want that. Often people think that Botox kicks in immediately. I have actually seen, I can't remember what it was on, maybe The Real Housewives or something, where somebody was having a Botox party and the people were having it done, and the people that were at the party were going, oh my God, you look amazing. And I was like, nothing happens. When you get injected, you don't know that you've been injected. You can't tell. There's no way of knowing. There wasn't even any, sometimes you can get bruising, and sometimes if they hit a vein, a little vein pops up. I had no bruising, nothing. My husband wouldn't have known. He was waiting in the car for me. He took me just in case I did feel a bit weird afterwards, or in case I was too nervous. And there's no way he'd have been able to tell. There was just no marks. Maybe if you looked very closely, you could see a little needle mark, but you don't feel anything for at least 3 days. And again, I know this from the years of having Botox. At 3 days, things start to happen, so when I would have my eyes done at 3 days, I could start to see, okay, it looks to me like my eyebrows are dropping, or it does look like they might be starting to, lift, or I can't what's this called? Frown, I can't pull the two bits in, or I've always been able to lift my eyebrows, but it then takes from 3 days to up to 2 weeks to kick in fully, which is why if you go for Botox, you'll often get a 2-week review. You'll go back in 2 weeks and they'll ask you how it is, because it can take it's different in everybody. Some people see the results fully in 3 days. Some people it takes up to 2 weeks. But in 2 weeks, everybody will have the full effect. Botox will be in, it will be settled, and that will be the results you get. So with that in mind, it's only been a week since the 2-week point. So for the first 2 weeks, I kept watching my eyebrows to see if I could pull them in, and I still can. And I did feel like after a week, I could see them dropping, and my eyebrows have dropped, definitely. I can see in videos, I can see in pictures that my eyes are usually, there's normally more space here when I'm talking. I'll try and see if I can put in a picture for you to show before and afters. I was told that there shouldn't really be any major side effects that you would feel, other than some people left me comments to say that they got the most horrendous headache. In fact, somebody said to me, she said, prepare for that and you know, accept that you'll get a horrible headache and you'll be fine. I didn't get that because my migraines aren't always, I do get a headache at some point during the day, but the headache itself is not always severe. It's all of the other symptoms that go with it that are just as bad. So I didn't have the worst type of headache ever. And a lot of people reported, and I was told that I might get neck pain. So the nurse said to me, you might get some neck pain, because what happens is they've relaxed certain muscles and then other muscles compensate and therefore become sort of stiff and sore for the first little while. That's the only thing I've had. There is a muscle here, and it's almost as if they've forgotten to inject it, because I feel on this side, I can't feel any neck pain. I've normally got neck pain on both sides. Actually, let me see if my trigger point still works. Oh, yes, it does on this side. Yes, you press into, they did inject in here, but there's a bit in here that I can press and get a shooting pain in my eye. Let's try this side. Yeah, they're both still, I can still trigger pain into my eye by pressing those. But what I was saying was that it feels like they almost forgot to inject this muscle or something. It's just been very stiff and sore ever since having the injection. So I've just been using a heat pad and whatnot. And it's not stiff and sore when I'm doing things, it's even if I'm sitting down, it just feels like it's turned into a rock or something. So I've been, like I said, using a heat pad and whatnot. It's nothing that's unbearable at all. That was the only side effect I've had. No breathing issues, no swallowing issues, no, like I said, major headaches. I've had days where I've had my severe migraines, and I've had days where I've had really bad headache, but I didn't have like the mother of all headaches as a result of this Botox. I don't know if that makes sense or not. So has it worked is the big question. Well, I didn't think it had, because for the first 2 weeks, basically my life was the same. Funny enough, on the day where I went for the Botox, I was having a sticker day. I call a sticker day when I don't need to take any major pain relief. So be that diazepam or tramadol or I don't need to sleep. If those 3 things have been achieved, then it wasn't a major migraine day. You could say it was moderate and I took codeine and coped with it, or it could be mild where I took codeine and the codeine worked, or I took paracetamol and the paracetamol worked. I don't take an awful lot of codeine now, I don't take very much at all, but on days where it's worked and I can get on with my life, that's a sticker day. And the Botox day was a sticker day. The day after was not so good. And then for that next 2 weeks, it just followed the same pattern as it has done for months now. So for the past 4 years, I've had this migraine, these symptoms come on probably about lunchtime and last until about after dinner. So say from 12 till 7, something like that. But in the last 3 or 4 months, they've been going on daily. So I've been waking up with a headache, getting up and instantly feeling terrible. I'm feeling terrible all day, and it never really goes away. So it kind of followed that pattern with the occasional sticker day, which would happen once every couple of weeks. I'd get a day. The maximum I've ever got is 2 days in a row. In the last few years, the maximum has been at 2 days in a row where I haven't felt awful. At Christmas, I got 2 days in a row. So yeah, I was feeling pretty disheartened, but I just kept thinking, right, it hasn't fully kicked in yet. It hasn't fully kicked in yet. It could still work. The Wednesday arrived on where the 2 week point was, and I was like, I still had a bad day, and I was like, that's it, it's not working, you know. I was like, I don't think I maybe had 1 sticker day in that 2 weeks and maybe a couple of moderate days. But I was like, I don't think this is working for me. So I had, in the meantime, stopped HRT because, and I've talked about that in another video, but there is the synthetic progestogen that I was on is something that can worsen migraines. So in the meantime, I had stopped that as well. That was last Wednesday, and today is Wednesday. Things then got a bit better in that the day after the 2 week point, so the Thursday, I think it was the Thursday, I had a sticker day. And I was like, this is wonderful. Then on the Friday and Saturday were moderate days, and not only were they moderate days, they were moderate days in the afternoon. So it meant that I felt okay in the morning, but by lunchtime I was feeling rubbish again, but it wasn't something that made me need to lie down. I could work through it. And so that was an improvement, because what I should have mentioned is that she told me, this is not the cure, and you get a leaflet afterwards telling you you're not going to be cured from this, but it should reduce your migraine by, I think they said 50%. Yeah, 50%. You should get a reduction of migraine days of 50%. That would be amazing for me. If I got half of my week where I wasn't feeling the way I was, that would be brilliant. And actually she was saying the guy that was in charge of the study on the Botox for migraines, he got a 70% reduction. So I was trying to be quite upbeat about it, and thinking, well, things have definitely been better since Wednesday, and it's not a cure, so as long as I get a reduction, that's great. Then came Sunday, and Sunday just gone was a sticker day, as was Monday and Tuesday. So I've now had 3 days in a row, up to yesterday, that have been mild days. So this is not to say I don't take painkillers, because I have taken paracetamol and a little bit of codeine, but in taking that, my head pain has gone, my other symptoms have been mild, and I've been able to get on with my day. I'm not saying I'm bouncing around with energy, but I just feel like a normal person of this age, with the normal aches and pains. It's not stopped me doing anything. That's amazing. That's absolutely amazing, because like I said, 2 days, consecutive days, is the most I've had in a long time. And so to have 3 days, possibly 4, because today it's 20 to 10 at the moment, and it could change at any point today, and it's hard to be positive about it actually, because you get into a routine almost, to saying, okay, I need to get this done because at 11 o'clock I'm going to start to feel rubbish, and you shouldn't really think like that. It should be more positive. But this is day 4 that I'm feeling so far okay. Now, I did have a headache when I woke up. I could feel a headache lying in bed, but yesterday I did my exercise bike. This is the thing that's even more amazing actually, is that I have done 30 minutes on my exercise bike, which my husband wasn't happy at, because I was supposed to be building up slowly, but there you go. I've also been filming and I've been editing over the last few days. So I've been sitting at the computer, I've been filming like I am now, and yet I'm still on day 4 so far of a sticker day, which that is unheard of. So that makes me think that I am having some benefit from this Botox. And what's quite exciting about that is that she thinks I could get a better benefit from having more in my neck, which I think would be true. I know that my neck is what triggers my migraines, and it's anything that involves my neck, whether it's sitting at the computer, even riding the bike. I have tension in my neck all of the time, and have tried so many things over the years to not be as tense, Now, I hope it's the Botox, because then that means I have, something that's going to help me. There'll always be that risk, and I'll always be anxious for a few days after, it starts to kick in, like, is it going to affect my breathing? Is it going to affect my swallowing? But at least there would be a solution. But the one thing to say is, I'm saying that I haven't had 3 consecutive days for years, but in 2019, just before Christmas, I had a couple of weeks, a really good couple of weeks, and I had gone to see a physio, and I thought that she was the cure. She had, whatever she had done, I had a good couple of weeks where it seemed like, right, that's it, it's all gone. I was back to going to the gym and living my life again. But I guess you could say I relapsed. It just all of a sudden I was back to getting daily migraines. So I'm not sure what that 2019 couple of weeks was all about, and I am conscious that this could be it could be that, it could just be a fluke. So the good thing is you can't have this very often, so you can only have the Botox every 3 months, because although some people are told when they have cosmetic Botox that it could last up to 6 months, at 3 months it's pretty much out of your system. There can still be some residual muscle weakness, there can still be possibly a little bit in your system, but pretty much it's gone at 3 months. The effects are gone. And so they make you an appointment for 3 months as you leave. So I have an appointment on the 31st of March to have my second lot of Botox, and that will be the bigger dose. What happens then is they make me an appointment then to see the neurologist, and you have a review. And you can continue to get the Botox if you have a 50% or more reduction in migraines. So if it's worked, you'll just continuously get that every 3 months, which I'm more than happy to do. If it hasn't worked, I can then move on to getting the Aimovig injection. Some regions do Adjuvig, some do Aimovig. Aimovig is what we get here. But again, you couldn't just say, I don't want the Botox, I want to go straight for the Aimovig. They won't give you the Aimovig because it's so expensive and we're not paying for it because it's the NHS. They won't give it to you unless you've had the 2 lots of Botox. But the good thing about that is there's a 3-month, I can get 3 months worth of data. Let's see how I am for the next 2 months, and it'll be interesting to see. Knowing me, I'll probably put it into an Excel sheet and see if there is any trends, and if it just does go downhill, or if it is sort of steady and with dips or anything like that, to try and figure out, is this helping? I definitely think stopping HRT has helped from the point of view of, I feel like when I started taking the HRT, that's when the migraines became 24/7. So I feel like without that, it goes back to being just mostly from lunchtime onwards, which is neck triggered. I think that's everything as to where I'm at the moment. So I am cautiously optimistic. I'm trying not to get giddy excited about it, but it's hard because it means so much to me having days like I have the last couple of days. Kev was like, my God, you've never sat down. And I'm like, I know, isn't it absolutely amazing? Because that's how I used to be. That's the Karen that he married. I never sat down. If I had a day off, I wouldn't sit down. I would be, doing things in the house or going out shopping and then doing things in the house and constantly changing the sheets and cleaning. And I enjoyed all those things, and I do enjoy all those things. And it's just, I enjoy sitting down at the end of the day going, you know what? I've done so much today. That's what makes me happy, and I've been able to do that for the past few days. So I'm delighted. But I'm trying not to get too excited because, like I said, I've had a couple of weeks before and then it's all gone away. And also it could just be a fluke basically, but it's looking really good so far. So that's everything to tell you. Let me know what your experiences have been, or let everybody else know in the comments, because it's really useful. These videos are really good. I know that I looked up a couple of videos to try and prepare you for your appointment, but also to know, is it something you want to do? Because I don't know whether, if you're in the USA or, like I said, anywhere that doesn't have NHS, whether you've just got the choice, whether you can just go and pay for it. You probably can. I don't know how much it would be, because for the Botox I was getting in my forehead, it would be about 10 units. And so if you think I'm getting 150 units, for 10 units, it would cost about £200. So I'd imagine it's very expensive if you're going to be paying for it yourself. But I think that some people's insurance covers it. In the USA, I'm talking about the USA because that's where most people that I know that have migraines talk to me are from. So yeah, that's everything to tell you today. Thank you so much for listening, and thank you for your continued support. I wish you well. If you are having daily migraines, there's lots of things you can try. You can try magnesium supplements, have helped some people immensely. That's something I tried and didn't work. B complex, B6. There's quite a few things. Have a look on Facebook forums, have a look on the Instagram. There is somebody called The Migraine Life. She is just brilliant. She can tell you so much about migraines. So yeah, that's everything. Thanks so much, and I'll speak to you again soon.